the aspects of our organization that separate it from care in hospital to the care provided in the hospice house are multiple. The first and easiest to recognize is the setting and the building that we're in, that it is designed to allow patients and families to relax, to know that they're no longer under assault, and that unexpected things are not going to occur here. And the building also is meant to express our desire to treasure and really cherish the life of the person, the soul of the person that we're given responsibility to care for. It is kind of a grand-looking place, and it is meant to let folks know that resources will be expended to make sure that they're taken care of, to make sure that they're comfortable and safe and loved. So the building is a nice thing. It's a different atmosphere in the building, a calmer atmosphere. There aren't lights and gongs going off. There's no overhead pager. And the general pace of care is much less frenetic than it is in the hospital. And there's not a need to quickly make a diagnose, initiate treatment, and discharge the patient. That we go on a completely different time scale in hospice. And the things that we consider important, when I say we, I mean the care team that's assembled here, the nurses, the pharmacist, the volunteers, and the support staff in the kitchen and housekeeping. The things that we consider most important are different than those that are made primary in the hospital. We want to understand what it is that the patient wants for him or herself, and we want to allow that person the time to put their life in perspective, to come to an existential point of rest where they are at peace with their Maker, as best they understand that entity to be. There's, of course, a Christian view that we are deeply steeped in, but we have had patients here who are adherent to the Hindu faith. We've had Taoist monks here to provide care for our Buddhist patients. We've had lots of Jewish patients and a great many agnostics as well. And we've been able to get them all to a point of comfort and perspective. The other element that's different from a hospital is the degree to which the family is integrated in the patient's care. The rooms are all set up to allow one or two family members to rest there overnight if it's their desire to do so. We are contacting them several times a day as to how are things going with their loved ones. Do they have any needs or concerns? And there's I think a fairly tight bond between the registered nurse who's providing care for the patient over a 12-hour shift, who's often the same nurse 4 or 5 days in a row, and the family members. And they are the barrier or the hesitation to ask for help is much lower here at the hospice house than it would be in the hospital. And folks will naturally bring their needs forward in a more relaxed manner, generally less of a crisis, but just change in the situation that they already understand. The the other thing that's unique to the hospice house and the in-home care, as apart from care delivered in hospital or clinic, is that it's always a nurse-forward proposition. That hospice is first and foremost about the delivery of nursing care and comfort to the patient. Certainly I have an important role to play in choosing which medications are to be used and how they're to be dosed, and other interventions, and from time to time come up with a psychological insight. But mostly it's the nurse at the bedside who is treating the patient. And our nurses have a bit more autonomy in the use of medications and other interventions to see to the comfort of the patient. So I will be available 24/7 over phone for consultation, or the doctor that's covering for me at the time. But it's a nurse-driven vehicle here.